session, I will upload it, but I think during the session you can turn off the video, then you can hear very well. But you can see also the other person. That will be the easiest.
Okay, but I'm trying to connect, even connection is not coming.
It's not connecting to the Zoom at all?
It's not connecting to the Zoom.
Okay, I will record the session anyway and see if you can try again later on, and then if you can join us, will be good. Okay, but we will start the session anyway in another minute is joining, and then we take it. Okay. Okay, and try it then later on if you can connect, this will be good. Okay. Okay, bye. I think it's a problem in Israel, in Uganda. It's also my student that cannot connect. I don't know what to do. I will record the session, and David and Mangasa and you, Batanda, explain the session to the rest, okay? You will be
Yes.
the lecturer assistant.
Yeah, no problem.
He's very good, by the way. He's one of the best in Israel, in healthcare and politics. Next Thursday, we have also an excellent. Can you hear me? Can you hear me?
I mean, I can.
You don't
Yes,
hear
we
me
do.
at all? What do you think? Should we? Here we go. Yes, Tim.
I can hear
Hello.
hearing you.
Can you hear me?
Can you hear me?
Can you hear me well?
I hear you very well. I don't know about the rest. They have a very bad connections problem.
Okay, I will try to do something because I barely hear you. Let's see what can I do. Can you continue until I will fix it? It will take me 1 minute.
I hear you very well, Nissim. Mangasa, can you hear?
I hear everything.
Yeah, I can see that you hear, but I can't hear you very well.
Yeah, I think
It's very important that I will hear you because I would like to hear what you have to say.
Mangasa.
The problem with everybody. You know, try to connect without the video. If you're successful, just listen, and then without the video and the microphone, maybe it will work better. Try if you can. If not,
Just a minute, I will fix
I'll
it.
record it and then see. Okay?
You sent is for the morning session.
Yeah. You didn't get the link for now. No, maybe I sent you the wrong one. Hold a second. Hey, that was me. I thought that I had. Hold a second. I think that this one, the right one. I'll send you in a second. Tell me this is the one you got. Or bear with me. Tell me if I'm sending you to the WhatsApp. Tell me if that's different. If that's different. Is that different?
Let me see. You've sent right now.
Yeah, to the WhatsApp.
I haven't seen it yet.
I just sent you to, hold a second, hope I sent it to the right place. No, hold a second, I'm sending you now. Michael, you say I sent it to you.
Okay.
And I'll put it the other one too.
Amos, can you hear me good?
I hear you very good. It seems like you okay. Mangasa, I hear very well, but all the rest have a hard time. Also, my student from Kampala have a hard time. Charles,
No, David,
Charles also called me and said he.
I hear you very well.
And Nissi, for all a second.
Me, I can hear
I
you
hear you
very well.
Doctor.
David, I have to tell you, I didn't say,
We hear you.
yeah. I wanted to tell you, I developed in Academy City a new type of Zoom. Totally different type of Zoom. And in which we, oh, here we go.
Oh, yeah, I ordered someone to help me because I'm not qualified for technical devices. I'm sorry, but I understand that you can hear me well now.
We can. Me, I'm seeing you.
That's great. That's great.
Nissim,
We are
I'm
hearing you.
recording also I'm recording it. Apparently, there is a problem. I know of 2 or 3 guys from Kampala having a hard time also to connect. And that each one of them in a different city in Uganda. So Ginger, we lost Ambrose. It was.
I'm on.
Are you on? Turn on
I'm very
your
on.
video so we can see you. Just to see
Eh?
the video. And then, Nissim, what we will
They
do,
have switched.
we'll reduce some of the videos so the connection will be better, hopefully.
That's okay.
So they can hear you better. But I think you should leave your video. I will leave mine, or I can even turn mine off if you want. Let's see how it goes. So go ahead, it's all yours. I will give you sharing. Let me introduce you first. Nissim is a professor in University of Haifa. Really, I think the lecture of today is really one of the most interesting one and related and very relevant also to what's happening today in the world, I would even say. And I will let you, Nissim, go ahead and introduce yourself.
Okay, thank you. Are you seeing my presentation well?
Yes, yes.
Yes, great. Okay, so first of all,
Yes.
Now I'm ready. First of all, I'm very happy to see you and I'm very happy to be here. My name is Nissim or Nessi, and I'm a professor for public policy and administration at the University of Haifa. And today I would like to speak with you, to discuss with you about a very interesting yet very common phenomenon, which called informal payments for healthcare. So my central goal in this presentation is to claim or to explain how and why could informal payments for healthcare, which we may call also as self-provision of public healthcare, how this phenomenon can pose a threat to democratic values, how it may prevent democratic process in a country. But I would like to do it in a very interesting way, in a special way, in a way that will introduce you several aspects from public policy and administration. So I would like to speak with you about this phenomenon using the term street-level bureaucracy. We will explain what is street-level bureaucracy. Perhaps several of you already know that, but we will talk about street-level bureaucracy. We will, of course, speak about informal payments for healthcare, and then we will connect it to a broader phenomenon of political participation, and then I will address specifically a term called alternative politics. I know that it's sound gibberish right now, but I promise that it will be interesting, and I promise that I will speak slowly, and I will be very happy if you will ask me question. Please feel free to interrupt anytime, ask me question, or if something is not clear, please stop me and ask me immediately. Don't wait. You know, we in Israel are very direct. This is part of our culture. So it will be different from people in Western cultures who will give a lecture. They are much more polite. We are very direct, and we will be happy. I will appreciate if you will be direct with me and stop me any minute when you need to know something or something is not clear. So this is what we are going to do. And first, I would like to start with the term street-level bureaucracy. What is street-level bureaucracy? So, Amos, perhaps you would like to mute everyone,
Yes,
because
yes.
I'm
Mute
hearing an
everyone.
echo.
And we'll,
But
anybody that wants to talk can just turn on the microphone. Go ahead, Nisi.
And this is off. Can he come back on? We are waiting.
Nisi? No, I can't hear him either. Let me, hold a second. Nisi?
you put me on mute.
Yeah, I put everyone. That's what I put everyone. So you go ahead.
So when in the first course of public policy and administration, students are introduced to four main players in the policy arena. Four main players, and these players are first and foremost the politicians, the elected officials. The second player are the bureaucrats, the appointed officials. It could be a political appointment or appointment which is made by a tender. So these two players are governmental players, and then comes the third players, which are called the interest groups or pressure groups. These are players who are outside the government system. It's like interest groups, like businessmen who wants to promote regulation they would like to have or something like that. And the fourth player are the public. So we are concentrating now in one of these players, the bureaucrats, the public officials. And when we are talking about bureaucrats, we can distinguish between low-level bureaucrats like you and a much more lower level bureaucrats which have a special term which called street-level bureaucracy. What is special about street-level bureaucrats is in addition to that they are low-level bureaucrats usually, is their daily interactions with clients. It's like social workers, policemen, nurses, doctors in governmental hospitals. They have daily interactions with clients, with citizens' clients. Usually, in all countries, they lack of resources. They are working under extreme pressure. And I think the most important characterizing of their work is their discretion. You can't replace these people with procedures. No one can tell the police officer when is the good time to pull his gun, or to a social worker when you should take children from a family because they are a threat. So their discretion has a lot of impact on policy result, and hence their importance in the policy process. So during the last 40 years, scholars understand that these players are eventually a co-maker of public policy, because you can say whatever you want as a high-level officials or politicians, but at the end, this is the single teacher, nurse, doctor, police officers who make the decisions, and their discretion can impact crucially policy results. So everybody understand what is street-level bureaucrats, what I am meaning when I'm saying street-level bureaucracy.
Yes.
Okay, now what?
Yes, we do.
What the literature, what the scholars of public policy and administration are trying to understand in the last few decades is which factors promote or influence these people, these bureaucrats, these street level bureaucrats, which factors eventually influence their behavior. And here we can talk about personal characteristics. This is something which is inside the players, something which is intrinsic inside the people. It could be his belief, his values, his standards, and even his self-interest. Many times he will act when he work according to his self-interest and will think about the benefit that he will gain from his decisions. We also know that the second factor that influence these bureaucrats are organizational conditions. And when we are talking about organizational conditions, we are talking about the incentives offered them by their organizations, the organizational culture, or the resources, if the organization give them resources for their work or not. So this is a second factor that influences their work. And last is the environment. And when we are talking about the environment, among other, we are talking about culture, about their culture. And indeed, Evelyn Brodkin, which is one of the most leading scholar of street level bureaucracy, she recognized that personal preferences, like personal characteristic, is not irrelevant. It is indeed an important factor that influence street level bureaucracy, but she suggests that it also mediated by organizational conditions. And what I will try to offer you, to convince you, is that we cannot connect the environment from the work of street level bureaucracy. This is something that I've been published about when I was studying informal payments for healthcare in Israel, as I will show you next. We also suffered from this phenomenon, from bribery in the healthcare system. We will talk about it. But before we will dive into the specific, I would like to draw you the broader context of my claim, which is it's not only the person himself, it's not only the organization, it also the environment. And when I'm talking about environment, I refer mostly to the culture, to the political culture, and the general, even the general culture in society. Now, what is culture? Anyone would like to tell me, or to explain, to suggest what is culture? When we are talking about culture, what are we talking about? I will wait 3 more seconds. Perhaps someone want to try. What is culture?
Culture, yes, David, I'm here. Culture can mean too many things depending, but the societal belief, what you believe in as a society, what you believe in, what you are accustomed to, what you've grown into, what surrounds you, what environment you've grown in, shapes your culture, your way of belief, your way of thinking, your way of living, your way of dressing, your way, the environment. If I try to explain.
Yeah, it's very difficult to explain. And I have difficult to explain it when I'm studying and writing about culture, and I'm struggling to define precisely what is culture, because it's very hard thing to do. Perhaps no one can ever do it well.
I have an idea.
Yeah, I would be happy to hear.
Yeah, for me, it is a socially acceptable way of behavior within a community.
Like norms.
Yes.
Okay.
Customs.
Customs.
Customs is social behavior.
Well, you're all right, but the common agreement among scholars is that culture is a mix of values, norms, and the difference between values and norms, that values is like what we would like ideology, while norms, it's what's happened on the field, yeah? And even symbols like the flags, or even the national, we say non, the national, the national song. It could be signs. It could be a lot of things, but it will never be only one thing. It will never be only the values or the norms or the symbols. It will be the mix of all these things. Now, when we are talking about culture, we are actually talking about informal institution. What is institution? Institution is not like an organization. When we are talking about institution, we are talking about the rules of the games. Like constitution is a formal institution. A law is a formal institution. When the government or the president decide or published a regulation, this is a formal institution. And we know that formal institutions influence people. But the literature also stress the importance of informal institutions. And here we are talking mostly about culture. So culture is an informal institution. One thing that is accepted in one culture could be unacceptable in other. This is connected to what I told you before about me as an Israeli, which is very direct. So this is like something that there is no regulation that tell me that I cannot be direct when I speak with people. And yet, when I'm meeting scholars from Europe, from the US in conferences, I can feel sometimes that my approach is something that is not part of their culture. This is like an informal institution. And sometimes I'm feeling that I'm doing things that according to their culture it is forbidding. This is like culture as informal institutions. It's like the rules of the game, but it's not formal, it's informal. So if I conclude what I said so far, I explain you what street level bureaucracy is. I explained that street level bureaucrats are low level bureaucrats with daily interactions with clients. And I told you that one of their most important characteristic is their discretion. And I also explained that there are three factors that influence street level bureaucracy: personal characteristics, the organization in which they are working, like their hospital or their town, their office in the government. And of course, the third and very important factor that I'm suggesting here is the environment. And when I'm talking about environment, I'm mainly referring to culture. So far, are you following? Is it sound reasonable to you?
Yes, it does.
Okay. Now, if we will go to the literature that focus on culture and on culture as an informal institution, we will find that in many countries around the world, all over the globe. Yes.
I see only your first slide. Is that what you planned on? That's what you meant? It's on your first slide, or it's got stuck?
No, I'm not on my first, no.
That's the only slide I see. I don't know if somebody else see another slide. I see only your first slide, so maybe you need to do the share differently. Yeah.
There for a long time.
Put it on the screen one, then it allow you to switch between them. I wrote you a chat, you probably didn't get it. Yes. Now.
So you didn't see,
No, we didn't, but that's okay. Just make it also bigger. I will, yeah, put it F5. You need F5 on your computer. Then everybody will see it's bigger. Yeah. On the bottom, you can see on the bottom you have this. Yeah, this
yes.
one. Oh, right? A little bit. Yeah, this one.
Yeah, this is what I did, but you didn't see the.
Yeah, I
Now you
think
see
you have
it?
chosen in the share. Okay, let's try it. No, but I don't see it's big. Go ahead. Let's try. Try to switch slides so we'll make sure.
Yeah, I'm trying. Can you see the slides now?
Yeah, we do, but only number 2.
So let me go back. I'm sorry. Let's do it like that. Now can you see me when I'm changing slides?
Yes, now it's fine.
Okay. So I'm sorry it's small, but I will try to make it.
You can make F5. Make F5.
No, I'm with Macintosh. It's another language.
Ah, okay.
Sorry, I'm
No
sorry.
problem.
But I think that it will be better now.
There is a button, Nissim, on the bottom, on the right. Yes, this one. If you click on it, it should make it bigger, isn't it?
Yeah, but then when I'm switching, you can see it. I did it from the first time, so it doesn't work so much.
No
but
problem.
I think that's now it will be better.
This is best. Yeah, this is very good.
Okay. So that was my presentation about my slide about street level bureaucrats. Okay. And I told you that there are 3 main factors that influence street level bureaucracy. And we'll talk about culture as an informal institution. And what I am trying to present you now is that the literature identified in various countries this phenomenon. Like informal institutions are something which is common in many countries. If we will go to our neighbors here in the Middle East, there is the term wasta, which came from the Arabic word yatawasat, which means a middleman. So wasta is a name for exchanging resources inside the governmental system. Like if I'm a professor in the university and my friend is a professor in a hospital, I will take his son to do a PhD under my supervision. I will give him a grant, and he will take my son or my daughter to learn MD, to become a physician, to become a doctor. So this is a common culture in the Arab world, which is called wasta. In Chinese, there is the term guangxi, which is meaning also like under the table exchanges in order to make things work better and more efficiently with the government. If I have connections with the government, it will make me easier to open a business or to get the regulation that I want. In Brazil, there is this term called jaitu, also in the same principle of informal solution, let's call it like that way. In Russia, it's called blat or svazi. It's also common in Russia. In India, they call it jan pachan. In Israel, as I will explain deeply in a few minutes, we also have this phenomenon. We call it alternative politics. Alternative politics mean when you are bypassing the formal institutions, the formal laws, and establish new institutions in order to receive benefit from the government or from other places. And even in the UK, there is a lot of literature about pulling strings. They call it pulling strings. It's like making it easier get resources from the government or use personal connections in order to move things more smoothly if you would like to promote a new innovation or new initiative. So these terms are common all over the world, and it is all the same mechanism. It is all about bypassing the formal institutions and promoting informal institution. And this is always be part of the culture. So and now I would like to stop after we talk about street level bureaucracy. And after that, I told you that street level bureaucracy is influenced, among other, from culture all over the world. Now I would like to go directly to the phenomenon that we are talking about today, and this is informal payments for healthcare. Informal payments for healthcare exist in tens of countries all over the globe. And if I'm trying to map it and to point on specific places in the globe when the phenomenon is common, it will be mainly in the former USSR, in Eastern Europe, or even in the Central Europe, also in Asia, in many places in Asia, in South America, in Africa, as you may know, and also in other places, even in members of in countries who are members of the OECD, like in Greece, in Turkey, in Mexico, in Italy, and unfortunately also in Israel. And this phenomenon raised a lot of problems. There's a lot of articles and a lot of research devoted to this issue. And when researchers are pointing on the bad influence of this phenomenon, mainly it's increase inequality, because only the one who have the money can get better healthcare. It's increase inefficiency, because not everyone get the treatment they need, and as a society, we will pay for it with other future people with infections. I will give you a lot of examples next. And I think most important, it also reduced public trust it reduced public trust in the government. And this is something which is perhaps the most important one, because when there is a trust, you don't need anything. You don't need a contract. You don't need to enforce things, because you trust. You trust. What is trust actually? Trust is when I'm believing that other person will not hurt me if he will have the opportunity, that he will take care of me, and that he will give me, he will try to do good with me, even if I'm exposed to his power. So this phenomenon, informal payments for healthcare, proved to be one of the one that reduce public trust in public officials. And yet, when I'm talking about informal payments for healthcare, it is not a specific phenomenon, because we can say that informal payments for healthcare is when one is paying informally under the table for a physician, for a doctor, or for a nurse, in order to achieve better services, or services with higher quality or accessibility. But this phenomenon is much more wider than that. Because we do know that in a lot of places around the world, mainly in Eastern Europe and the former USSR, these payments are considered as a gratitude, as a present to the doctor, and it's happened many times after the the patient receive his treatment from the patient, from the physician. So it's not always part of corruption. And also when we are talking about informal payments for healthcare, in many places, these informal payments for healthcare are not informal, because they are eventually, like in Hungary, for instance, people can report to the tax authorities that they are paid to the doctor. I visit a doctor, I gave him a present, I gave him money, informal payments, but people can declare it to the tax officials and then they will receive tax reduction. So this informal phenomenon or payments in many cases becoming entirely formal. So I try to understand how can I speak with people all over the world in order that they will understand what informal payments for healthcare are. So what I've done, that was 6 or 7 years ago in an article that I've been published, I suggest a typology of informal payments for healthcare. And this typology is based on two variables. The first variable is legality. So informal payments for healthcare could be legal, or they could be vague or legal activity. And the second variable is improvement. The question is, does the payment improve the payer situation? So informal payments for healthcare, I can pay and have a better treatment, or I can get equal or the same treatment that I've been I could have received even if I wasn't paying this informal payment. So it could be equal or even worse treatment. So this is the typology I suggest. So black payment are probably the most discussed and critiqued type of informal payments for healthcare. In these cases, the payment is given illegally and the payer receives better treatment. This is, of course, a bribery, okay? But gratitude payments, here, although this is informal activity, the payer did not break any formal law, and he received equal treatment like everyone. So this could be a gratitude payment. Are you following? Is it okay so far? Yes, Amos?
Yeah, we are following.
Okay.
I joined late, but I'm following it.
Okay. Again,
We are following.
If something is, if I'm talking too fast or something is not understandable, please stop me and I will be happy to explain again. So there are very many types of informal payments for healthcare, and I told you, gray payments are also something that we should discuss. Gray payments also prove to be a dominant configuration of informal payments for healthcare. In these cases, there is no obvious rules forbidding the payment. Hence, the payment is legal, it is given legally, and the payer eventually receive better treatment. So this is on the gray zone. Lost payment, this is something that I had to put here in this typology. I never saw this type of payments. This is a theoretical observation. It is not reasonable that people will pay informal payments for healthcare illegally and that it will receive from the doctor worst treatment, but this is an option, okay? So now, after we understand, and again, we talk about street level bureaucracy, we talk about informal payments for healthcare. We understand that informal payment for healthcare, as I will suggest, is part of the culture. Now I would like to speak with you, not theory, but what's happened in the real world. And I will be happy to discuss with you about the phenomenon of informal payments for healthcare in Uganda. Do you know why I put this? Do you recognize this? I guess that you recognize the woman.
Yeah, she's a minister.
Yeah, this is Dr. Sarah Opendi, a minister.
Opendi.
Opendi, yeah. And 3 years ago, I don't know if you remember, but 3 years ago, she did something very interesting.
She dressed
when
like
it comes to informal
a
payment.
Muslim.
What
Dressed up like a Muslim and went to a hospital.
exactly? Can you tell us the story? Can you tell us what's happened?
I think she was trying to track the theft of medicines in the hospital and to follow up the treatment, how patients are handled when they come to our health facilities. So she went to a facility in Kampala dressed like a patient, a Muslim patient.
With
And I
hijab.
think some medical staff tried to get a bribe from her.
Exactly.
And they were arrested.
Exactly. And you forget to tell us about the camera, the crew that came and pictured the whole things. Yeah. She
Of course, the
disguised
cameras were
herself.
recording.
Yeah. She came with a Buddha. This is the right term, with a Buddha, with hijab. Eventually a camera crew pictured the whole thing, and eventually they were arrested. So what I didn't
Only she didn't mention that she arrested small people. They should arrest bigger ones, not those small ones.
I'm sorry.
But that is for another discussion.
No, I would like to have this discussion here.
Charles now to Koya.
Please proceed.
At least somebody was arrested.
Yeah, 2 people, low-level laboratories were arrested. Yeah, I think that I understand what you're saying. The hospital manager, CEO, thanks her for her initiative, but I think that I understand what you're saying. So I never study informal payments for healthcare in Uganda. I did read several articles before I met you because I want to come relatively prepared. And I know that you have a very complex healthcare system. You have the private system and the public system. Is that right? When resources are moving from one sector to another. How is health services in Uganda, from your perspective?
Yeah, we have private, we have public, and we have private not-for-profit. We have hospitals which make profit, but we have also public hospitals from research center 2s, 3s, 4s, up to the referral hospital, free and public. Then we have private clinics, hospitals that are for profit. Then we have private not-for-profit, which are Christian-led or organizational, NGO-led.
And how is the public system compares to the private one?
Definitely, the public facilities are overwhelmed with numbers, and you don't expect to have the efficiency that the private sector, which is the cash-based delivery, to be at the same level.
Okay.
And the private sector strives well on health insurance.
I understand. Does the phenomenon of informal payments for healthcare is something which is common in Uganda?
Happens. You know, I think this happens really. These are pockets. There are pockets where it happens. If I want my patient to be treated very quickly, I may be, due to the condition, I may be prompted to tell the doctor, my friend, just concentrate. These things happen.
Okay.
So,
according to the literature, and I would like to do it, I never have been to Uganda, but according to the literature, articles that scholars write about informal payments for healthcare, people tend to agree that informal payments for healthcare, bribery, like black payment, if we will go back to my typology, yes, black payments, and scholars tend to agree that bribery is a common phenomenon in Uganda health sector, and the estimations are that 1 in 4 Ugandans who engage with the public healthcare sector are asked, not suggesting, asked to pay a bribe for services, and this is only the data that we know of. Because now I'm studying informal payment for healthcare in Israel, and in a few minutes I will tell you that this phenomenon exists also in Israel. And one of the things that I understand is that the numbers that I get are only above the surface, because people usually do not happy to tell me, yes, I pay bribery to the doctor in order that my father or my son will get a better treatment, or I can choose the head of the department that he will operate my father. So usually people are not telling the truth. This is something that's happened all around the globe. So the numbers, I can only estimate that the numbers are even higher than 1 in 4 Ugandans, which means in a relative to other countries, yes, in a relative manner, it says that this phenomenon is very common in Uganda. Again, this is not from my personal knowledge. This is only from things that research that I read before our discussion here, and we know that there are the people in the healthcare system are very badly paid. So if I will, how much money do a doctor earn in the public system in Uganda? Do you have any estimation? Well, from what I've heard, nurses are earning something like 400,000 shilling, and a doctor can earn something like 700,000 shilling, which is like $250 US dollar, which is, I think, relatively small compared to a civil servant on average. According to my data, the average civil servant will earn 3.8 million, like 1,000 US dollar. So one of the main problems of the healthcare and services in Uganda is that the staff are paying very badly. So this is something that we know that is happening. We know that there are that the healthcare system in Uganda does not enjoy a lot of resources. We know that the people, the street level bureaucrats, now you understand what I'm talking about. We know that the street level bureaucrats are badly paid. And something else that we know is that bribery in Uganda reduced in the last 10 years. At least this is what studies, research is saying. I'm not sure if this is what's happening in practice, but an article that published a few months ago claimed that bribery in Uganda healthcare system reduced. He even suggests that it was reduced drastically in the last 10 years. So is it true?
Yeah, it is reducing.
It is reducing. Why?
Some pay is being, doctors now, the science students, they have classified workers, those in science, science-led areas or lessons or subjects or training are being paid more.
Medical
So
staff
that
are
one,
enhanced.
medical staff.
They raise their salaries? This is what you're saying?
Yes.
Okay, if you believe that personal characteristics are the main dominant in street level bureaucrats' decision making, perhaps it will decrease. But if you will go with me, and my suggestion is that informal payments for healthcare is part of the culture, it will be very problematic to believe for this research. So again, there is article or saying that bribery has reduced significantly in Uganda, and they suggest a very interesting explanation why it's happened. But before I will reveal it, I will be happy to hear from you. How can you? This is called anti-corruption policy that aim to reduce corruption. So how does it work? Why in the last 10 years this phenomenon decreased? Or what can explain it decrease? You know Uganda better than anyone else, so please tell me, how does this happen?
Can you phrase the question? Maybe I didn't listen. Did you understand it well? Sorry, for me, I'm David. Just give more light on what you want to say.
I'm sorry, again?
Can you ask the question once again, rephrase it for us to understand what you want to say?
What I'm saying, that studies, research articles on informal payments for healthcare in Uganda suggests that in the last 10 years, corruptions in the healthcare system has reduced significantly. And my questions to you, you're telling me yourself that corruption in the healthcare system is reduced in the last 10 years. And I'm asking you, why? What's happened?
I think there are three issues here. You hear me?
Yeah, I hear you right and clear.
One, there has been increased public sharing of information.
Okay.
In regards to financial transfers to health facilities. So the leaders, as leaders, we publish all the funds we receive to support health facilities. So the people know how much money is going to the health facility. Are you getting me?
Okay.
Two, the system of drug delivery, because medicines are demanded and requisitioned by the health facilities in line with their budget lines. And when these medicines are delivered, they are received by a number of people, not only the stores of the health facility, but the representative of the health management committee and other people. So it is the transparency levels have increased.
Okay.
Then 3 is when you are discussing the payment of doctors, my network had jumped off. But if you have noted, the past 3 years there has been an increased payment of salaries to the scientists, medical staff inclusive. So these 3 factors have helped to reduce the levels of corruption in the health sector.
Okay.
Yeah.
You know that in 2006, 2007, the auditor general reports indicate that there was a gap of, I think, something like 6 million US dollar between the parliament allocations and the national medical store regarding the drugs. And you're saying that transparency now these years is increased, and this is something that reduced the phenomenon among others. Okay.
Exactly.
Okay. So, you know, to an outsider, especially outsider that's studying informal payments for healthcare around the world, Uganda is a place that it will be very interesting to not everyone will understand how in a place like Uganda, bribery will be reduced from, because there are 3 main elements that will make you doubt that it's happened. First, as you know, and as the research shows, the public sector has witnessed several high-profile corruption scandals from high-level bureaucracy and politicians. So this is one thing that is still happening, and one can wonder how among street-level bureaucrats corruption is reducing, while on the upper level it's still existing. Second, as you know, this sector, the healthcare organizations, are suffering from a lot of, they are underfunded. They don't have resources for services, drugs, suppliers, and third, as I told you, the salaries in the public sector are quite low. So if you are looking at these 3 elements, although you told me that in the last 3 years salaries have been increased, I guess that they did not increase dramatically. But again, if we are looking about these 3 factors, these 3 facts, these 3 facts will make us very doubtful when one will tell us that that informal payments for healthcare have been reduced. And yet, no one can ignore the feelings and the reports of healthcare workers in Uganda that report that declare that they feeling that this phenomenon of informal payments for healthcare and bribery is decreasing in the last 10 years. So one very interesting things that we know about Uganda is the establishment of the health monitoring unit by the president Museveni, right? Museveni, I say it correctly? Museveni? Amos. I can't hear you because you are mute, but what do you know about
Museveni? Yes.
Yes, Museveni, Yoweri Museveni.
Museveni. Yoweri Kuguta Museveni.
Tebuhabulwa.
So 10 years ago, in 2009, he established this organization, the Health Monitoring Unit, and according to interviews with high-level bureaucrats and low-level bureaucrats in Uganda, this organization is perhaps the most important factor that reduce bribery in the Uganda healthcare system. So, do you know about this organization? Do you ever heard about him? Do you know how it's operate?
Let David Omangasa explain it. They know it very well, better than me.
Look, this health monitoring unit, it was a state house. It was from state house being managed by the current PS of health.
It is because it still exists.
Okay, but it was as aggressive in 2009 than today, because the leader was then, today is the PS, but it could come to a health center on, of course, tip off. If they hear there is some, they had the networks of informers who would come and say, health center X or Y has this or that. Someone has bribed here, someone is taking the drugs of this health center found in private drug shop. Then they will come, storm, get you red-handed, or find these drugs in the shelves on the tip-off. And then it was really aggressive. It scared many people. And I think it caused a big revolution at that time. Everybody was scared. You never know what would happen tomorrow. So it is substantially reduced. And all the drugs were stamped with each drug, even if it's a Panadol, a painkiller, it was stamped with government of Uganda symbols, also, such that it would be risky for you to have a drug meant for public health centers in your private clinic. So it really, to that time, worked. It caused the shock waves, and people feared to tamper at the time, to tamper with the public health drugs, or to do anything funny, because the informers were everywhere.
Yeah. So this, when you read about this, is, I think only 20 or 30 people are working in this organization, and look how much impact, how much change do they have? What is very unique in their operation is that they are working like intelligence, like mukhabarat, like undercovers. They are using very sophisticated undercover initiative. They are coming with television crew, and one of the most, I think, important element in their work is shaming, as one of you tell us before 30 minutes ago. You say that there is a lot of people now hearing about it in the news. So one of their main approach is to picture these events and then publicly publish it. So this one, this strategy is developed mainly under Dr. Atwaini. I think his name is Dr. Atwaini, who is the head of this this organization, and I would like to cite what he says when he has been asked why he succeeded. He said, "My relationship with the president was very significant." This is Dr. Again Dr. Atwaini, yes, the head of this organization. "My relationship with the president was very significant. Close ties. He was his personal physician, by the way. Everyone know that my office was in the office of the president, meaning he is not sitting in the Ministry of Health, he is sitting in the president office, and that I reported directly to the president. So I will never get political interference. No one will mess with him. even someone big. For instance, if I arrest someone who was relative to someone big, no one would interfere because they know that the president was on my side. Because this unit is at the center, people know that they must give it a total support. So this is something that's worth thinking when you trying to reduce this phenomenon. And again, this is only 20 or 30 people. But what if we are trying to understand what's make them more successful is two things. First, political will. They get political support. No one can touch them. They are relatively have the back of the president. And the second, their strategies. Strategies that are established or dominated mainly on the undercover operations and shaming. So this is something which is very interesting. Of course, we can't be naive. You know, for someone like me, we're trying to study the phenomenon of informal payments for healthcare in a broader perspective. I can perhaps say that what happened here is that we are catching the small fish, you know, while the big fish are still free to do whatever they want. So this is something that we of course put this criticism on the table, because again, it's aimed to the scale of bureaucracy and not to the higher levels of bureaucracy and political system. And the government is not looking like one who is sitting and not doing anything. They are demonstrating to the people that they are doing something, that they are trying to carve bribery. But again, this is mainly addressed toward what I'm calling the small fish and not the big fish. And yet, we cannot ignore that this is relatively understood as a progress, as a one major step toward reducing bribery. I'm not sure 100% if it's true, if bribery is indeed reduced in Uganda, but people at least talking about it. And this is becoming now part of the culture, as I tried to explain in our almost one hour ago. So now I will be very happy to hear from you in a few sentences. What do you think about this unit, how it's operating, and do you think that this is indeed something that you should encourage? Is it helpful? Is it a good strategy?
Hello?
Well,
It's
hello?
a good strategy. Hello?
We are listening, Ambrose.
So I was saying it's a good strategy. However, we also have to look at the operational costs of that unit.
It's only 20 or 30 people.
Come again?
It's only 20 or 30 people who are working there, a few dozens of people.
But how much are we paying to them?
Okay.
How much are we paying to them? You may find 10 doctors is summed up in one official in the unit.
Okay.
Yes. Okay. Also, for me, it is a reactionary approach now. Like after the former director moved to the ministry, the activities almost went down. So it was like it's not sustainable approach, because after she moved, she had a good relations with the president, but after she moved, there's unity almost, its operations came down. Yeah. So it needed to be streamlined or mainstreamed so that it can work effectively. Thank you.
Thank you. More comments, please. I will be very happy to learn from you. Would be very happy to hear your thoughts, because what I'm knowing is from articles, not from the field, and I will be very happy to hear your perspective on this issue.
Hello.
Daudi Yogera.
If I can comment, I personally feel it's not necessary. I strongly think, I remember, I will give you an example in Jinja, a referral hospital. This team came, this unit. There was a doctor who was only gynecologist in Jinja hospital. I'm trying to explain the scene. This man was one of the best doctors in the eastern region, around Soga region. And all women who were giving birth loved him, loved him because of his way of work. Now, there was a tip-off that he had taken 100,000 from one patient. 100,000 in Uganda is equal to $30, $25. The team came, bounced through the RDC, they got him, embarrassed him, put him on video, put him on radio. Look, the man had to, I think, resign or something, that embarrassment. So I would strongly think it had affected many doctors' morale. Many doctors, many professionals shunned joining public office, health system, because of such an embarrassment. My view would be, I think they must just strengthen inspection in terms of, we have the National Drug Authority, they could have teams, or whatever. They should have a system, online system, which checks drug use, distribution on a system, which does not require sometimes rudimentary method of approach. And then two, the system government is using to increase salary and bringing other incentives to these nurses and doctors. For example, where they should, maybe have the staff houses, some transport systems, some other incentives, like, so that they are quite comfortable. But bringing people, grabbing them, putting on camera, putting you on cuffs, a doctor, some of these professions that are very difficult to replace, I strongly think it doesn't make sense to me. So rather we will change the way we monitor the inspection and making sure really people are working within an environment that is safer. Of course, even in bigger places, some of these pockets of bad behavior could be there, but largely the system, we could be, inspection could be improved, and online things now can be monitored, how drugs are being taken out, how cameras can be fitted in some of these things, such that they strengthen meetings, they strengthen capacity building, they strengthen mentoring and training, such that people become better and appreciate that doing this kind of bribery work within the environment is not okay. Otherwise, that is my idea. This unit has caused a lot of negativity, and it had really caused some of these health centers people to abandon. And when you abandon, it's the common person who suffers. So I feel the change would be more on the systems enhancement than sending a unit to go and they hunt for people.
So they are using it to settle scores.
That is my opinion.
Yeah, this is a very complex phenomenon. I'm happy that you are sharing your thoughts with me. Usually people are not willing.
The unit may have, like my colleagues have said, may have had very good PR, but the output is yet to be traced. Because, like Charles Sangu said, you arrest 10 people, the whole system is broken down, but then you're not improving, you're not bringing enough drugs, They didn't tell the
Yeah.
president the truth. They were not telling the president the
Yes.
truth. And some of these suppliers of the medicines, some of the suppliers of fake equipment, when the doctors complain that the equipment is not working, the next thing you hear, doctors are being arrested there for stealing drugs. You know,
Exactly.
we have to be open on
So it
this.
was more of a conspiracy.
We need to build the systems which will
Systems.
help improve on service delivery, not knee-jerk reaction.
Haphazard.
Yeah, I hear you. I can hear you. I will be happy to come back to Uganda. But first, let me tell you in brief that I've been doing some research on informal payments for healthcare in Israel. And I think that from the year 1998, there was published a big research about black medicine, about bribery in the Israeli healthcare system. That was 22 years ago. And since then, the only articles about informal payments for healthcare, you can Google it, are my articles. Many doctors and physicians in Israel don't like me very much because this is something which is very hard to investigate and very hard to publish. No one loves to be accused in bribery. And when I released my findings to the Israeli government and I published it in an international journal. The Israeli not prime minister, the Israeli healthcare minister did not like it. I received some furious email, but again, I think that, and I will tell you in a minute why. And I told you, I think in the beginning, I think that informal payments for healthcare are directly linked to democratic values. You can't have informal payments for healthcare and democratic values in the same place. It's impossible to have it. So I'm doing this fight and I'm happy to do it. So I will tell you about two studies. One of them was in-depth interviews with doctors and nurses in Israel, 102 semi-structured interviews. And then the other one was a survey distributed to, I think, something like 1,000 and something Israeli people. And it received a lot of attention in the media, in the Israel journals, in Israel media and newspaper. And I will tell you that eventually the numbers for you will look like very small numbers, only few percentage. But I think that this phenomenon in Israel is a very problematic. And again, this is people who are reported that they paid black payments for healthcare, informal payments for healthcare, bribery. The numbers are higher than that. We know that. So Israel, as well as many other countries in the world, are suffering from informal payments for healthcare. Again, this is small numbers, but again, these numbers are quite big when it comes, if we will compare it to what's happening, say, in Britain or in Germany or in the Scandinavian world. So this is something that should bother, I think, everyone that would like to see society's country prosperous. And now I'm coming to the last part of my presentation. If you remember, I told you that we will talk about street-level bureaucracy. We'll talk about informal payments for healthcare. And I told you that we will talk about political participation and alternative politics. And I would like to say, or to suggest, that in Israel, as I told you, the phenomenon of alternative politics is something which is quite common. And it's based on Israel culture. I don't know if you know, I saved you the joke that we were supposed to be neighbors because Herzl, the visionary of Israel, want that the state of Israel will be in Uganda.
Kalamoja, you are still welcome. You come, we are still waiting for you.
I will be happy. I will be happy. I think that the neighborhood will be much better. No one will.
Amos is already our neighbor here, so you can come.
So I did not tell you this joke, but if we will look about the Israeli state, which established in 48, the Israeli ethos, the Zionist ethos is based on bypassing the formal institutions. The British mandate was occupying Israel for several years until 48, from 1917 to 48. The British did not allow the Jewish population to bring immigration from Europe. So what the Israelis do, they did an illegal immigration. They didn't allow the Jewish people to establish an army. So what the Jews do, they make a semi. Someone is talking and I can hear it. Amos, can you mute? Not me, but others. So the British mandate did not allow the Israeli state to establish an army. They established a semi-legal army. They call it machtarot. They didn't allow to establish a new settlement. So what the Jewish population do? There is what we call choma and migdal, putting facts on the table. Just come at night and build a new settlement. So this informal practices, which I call alternative politics, is part of the Israeli culture, is part of the Israeli ethos, and this phenomenon is when people are using informal institutions in order to supply public's good. Yes, when I'm going to the doctor and pay him under the table in an envelope money in order that he will take care of my father this week and no 3 months from now, because the public healthcare system is under a lot of crisis. This is actually bypassing the formal institution and making what I suggest a do-it-yourself approach, when citizens taking the law to their hand and adopt extra legal and often illegal strategies. And I will come back to this point in a minute. I would like to show you now a short movie that will help me to better explain what I'm talking about. Just a minute. I will share the screen with you. Can you see it?
No, we are not seeing it.
No, it
You're
is
not
there.
there?
Paramount Pictures.
Amos, can you see what I'm showing?
Yeah, it's good to start. It's okay. We can
Yeah, I
start.
see it's okay. How
Yeah.
about you guys? You guys see it? Charles, you see it?
For me,
I'm not seeing it.
Well, I'm putting it right now.
I can only see Batanda smiling now. I don't. Smiling machine.
Charlie Sibirike, if you can brave.
Murabe Batanda, you're not smiling.
I hope everybody saw the movie already. I saw the movie 3 times.
No, let us see the movie.
It's a great movie.
Let him push the movie on. We are waiting.
And I raised my daughter in the American fashion. I gave her freedom, but I talked to her neighborhood dishonor her family. She found a boyfriend and an Italian She went to the movies with him. She stayed out late. I didn't protest. 2 months ago, he took her for a drive with another boyfriend. They made her drink whiskey, and then they tried to take advantage of her. She resisted. She kept her honor. So they beat her like an animal. When I went to the hospital, her nose was broken. Her jaw was shattered, held together by wire. She couldn't even weep because of the pain. But I wept. Why did I weep? She was the light of my life. Beautiful girl. Now she will never be beautiful again. Sorry. I went to the police like a good American. These two boys were brought to trial. The judge sentenced them to 3 years in prison and suspended the sentence. Suspended the sentence? They went free that very day. I stood in the courtroom like a fool. And those two bastards, they smiled at me. Then I said to my wife, for justice, we must go to Don Corleone.
Why did you go to the police? Why didn't you come to me first?
What do you want from me? Tell me anything. But do what I beg you to do.
What is that? Come on, do.
I'll give you anything you ask.
We've known each other many years, but this is the first time you ever came to me for counsel for help. I can't remember the last time that you invited me to your house for a cup of coffee. Even though my wife is godmother to your only child. But let's be frank, you never wanted my friendship. And you were afraid to be in my debt.
I didn't want to get into trouble.
I understand. You found paradise in America. You had a good trade, you made a good living, police protected you, and there were courts of law. And you didn't need a friend like me. But now you come to me and you say, Don Corleone, give me justice. But you don't ask for respect. You don't offer friendship. You don't even think to call me godfather. Instead, you come into my house on the day my daughter's to be married and you ask me to do murder for money.
I ask you for justice.
That is not justice. Your daughter is still alive.
Maybe it's soccer then. She suffers. How much shall I pay you?
Bonus. What have I ever done to make you treat me so disrespectful? If you'd come to me in friendship, then the scum that ruined your daughter would be suffering this very day. And if by chance an honest man like yourself should make enemies, then he would become my enemies. And then they would fear you.
Be my friend. Godfather.
Good. Someday, and that day may never come, I'll call upon you to do a service for me. But until that day, accept this justice as a gift on my daughter's wedding day.
Grazie.
Yes. Give this to Clement. I'm unreliable people, people that aren't going to be carried away. I mean, we're not murderers, in spite of what this undertaker said.
Yes, I think that if you didn't so far watch this movie, sorry, if so far you didn't watch this movie, I encourage you to do it. This is one of the best movies that I've been seeing, and I'm watching it to you not only because I like it very much, because this is an example of alternative politics, and this is how I'm trying to make it now much more understandable when I claim that informal payments for healthcare is part of the culture, and this is part, and this is something that will threat democratic values. Because what we just saw in the movie, in case no one, there is someone who didn't see this movie, The Godfather, the undertaker is coming to this criminal, Don Corleone. He tells him that his daughter is suffered from a few guys, and he asks him to provide him a public service. He went to the police, to the court, and the police didn't do anything. The court released these guys. So what he is doing now is bypassing the formal institutions, the law, and approaching an informal institution, manifested in this case by Don Corleone, in order to supply him public services, justice. Don Corleone, give me justice. So I think that the phenomenon of informal payments for healthcare is, if we will look at it as a part of the phenomenon of alternative politics, which is again bypassing the formal institutions. And as you know, in Israel, I already told you that the historical roots of the phenomenon of Israel, even before the state of Israel, have been established. And this phenomenon is happening not only in healthcare system, and this is my claim. You can't witness an informal payments for healthcare and think that bribery is happening only in the healthcare system. If it's happening in the healthcare system, it will happen in education. If it's happening in the education, it will go to, I don't know, to defense or into any other place. There is a diffusion. This is part of the culture. And why I think this is a very, why I think that this is a very non-normative phenomenon, because some of you, or not you, some people may say that the phenomenon of informal payments for healthcare or alternative politics is actually a good thing. This is something that people who are not happy with what is happening with them, they're trying to better their situation, and it's better than doing anything. But what I'm trying to suggest here is that during diffusion processes, when people are learning, and this is becoming part of the culture, that you cannot really go on the right way to the formal institutions and get your public goods, public services, when you're getting used to live in a culture in which bypassing the formal institutions is the modus operandi. This is the only thing that works. It will eventually make you less and less, people will less and less participate in the political process. There is this term called political participation, when people are trying to influence the politician, to influence the bureaucratic system, to influence policy results. This is something that in the developed country, in the democratic countries, this is one of the most important values in Western societies or in democratic societies, political participation. When people are participating in the political game, and when they are doing it according or using the formal institutions. Alternative politics, this phenomenon of bypassing the formal institution, is the opposite of political participation, because people are learning, and this is becoming part of their culture, of their norms, as you told me 1 hour ago. People are understanding and believe that the only thing that will work is bypassing, is paying briberies, paying thing illegally. So we cannot isolate the phenomenon of bribery in the healthcare system from the better or the broader phenomenon of alternative politics and political culture. I hope that both in Uganda and in Israel, more and more people will not only understand that, but also work in the effort to curb this phenomenon. I know that I didn't give you any breaks. I'm happy that most of you stay with me more than 1 hour and a half. Actually, I finished to give you my presentation. Again, in this presentation, we talk about street-level bureaucracy. We talk about informal payments for healthcare. We talk about the broader phenomenon of political participation and alternative politics. And my claim is that informal payments for healthcare is not something that we should address only as someone needs healthcare, he gives some bribery, okay, we can ignore it. It's not something which is, it's terrible, but it's not a big deal. My claim is we cannot disconnect this phenomenon from the broader perspective and understand that this is something that can threaten democratic values. I will be happy to receive a question if there are any.
Thank you, Professor. Why do you think people engage in alternative politics or pulling strings? What are the major causes of this kind of phenomena?
Well, actually, I did a research on it. I just don't have the time to explain to you, but I will be happy to do it now. From what I have learned, there are 3 main factors that can explain alternative politics. First of all, lack of satisfaction. If I cannot receive the public goods, the public services in a quality manner from the government, and I'm dissatisfaction will be one factor. The second factor will be lack of availability to participate, to make voice, to go to the government, to go to the politician in my area and to tell him, I have problems, I'm not satisfied from the public goods, public services I receive. I would like you to work that and change the system. The system will work better. So when you are facing lack of satisfaction, you feel that you cannot participate because no one will listen to you, and you can shout about it until tomorrow, but no one will do anything. And when you feel distrust in the system, in the political system, in the bureaucratic system, these 3 elements are very good predictors to alternative politics. Whenever, all over the world, when you see these 3 factors under the same roof, I'm quite sure that you will find alternative politics.
Thank you. Thank you.
More questions? Okay, it was really a pleasure for me to see you all. I would like to thank you for participating, for showing interest. I hope you enjoy this lecture. I would like to thank Amos again for this opportunity to speak with people in Uganda. And I hope you and your families will be well with this crisis of Corona, the COVID-19. And I'm wishing you health and prosperity.
Thank you very much, Professor.
Thank you. Thank you. And
thank you very much. And maybe we shall engage more with our colleagues on that topic so that we get in-depth discussion later.
I will be happy if you will discuss it. And perhaps Amos will tell me what you're saying next.
Okay.
Amos, we can't hear you because you are mute.
Yeah, I just wanted to say that we're going to have 2 more sessions complementary. Also, the link between democracy and election, which coming in Uganda also. I think that's also from Professor Eran Gadot and Dr. Otara. So that will be really giving a good picture of the whole topic. So thank you very much, Nissim. Really, I appreciate it.
Bye. Have a great evening.
Thank
Bye-bye.
We'll take a break and we'll resume. What do you say? Daniel is in charge. I haven't heard Daniel today. What do you say? Is Daniel with us? Yeah.
Daniel, what is done?
Where is Daniel? Yeah, I see him. He's muted. Latanda, we make a break and then we resume for concluding. What do you say, David?
Perfect.
A few minutes for a cup of coffee.
Hello?
And then we have a short discussion.
Yeah, I'm already in coffee.
Ah.
Go on.
Charles, what do you say?
I think me, I don't take tea at this time. So let's have a small break. I take my 2 beers, then we resume.
Okay, let's take 5 minutes, something like 5 minutes, okay?
Time for beer. Yes.
Yeah, I will leave it open. I'll just go and get my coffee too. And then we'll discuss conclusions and where can we take it or what do you suggest, okay? So let's take a break for 5 minutes.
Okay,
fine.
Okay, 5 minutes.
Hey, Kamputeko.
Wasoma bw'oyiwayo omwana wange Ginisi.
Okalaba akacupa?
Onkalaba, wasoma bw'oyiwayo.
Ate nkole ntya?
Nkulaba teekako ekifaananyi.
Owo amagezi ne geeyongera. Amagezi ne geeyongera.
Owe Nathan tuyimiridde tutya mu bintu byonna.
Kyagala kubanga batanda ali awo.
Tanda muveeko naye mufu ali awo.
Simanyi.
We Mangasa. You Mangasa, I have sent you. You check our nani cluster.
Yeah, for us, we are opening our bids tomorrow, and evaluation will begin on Thursday.
You are very fast, man.
Yeah,
we are also going to move.
No problem. We need to serve the Ugandans.
Let's serve Ugandans at any cost.
Mumunda vile
Bobby, I am Kurabira. Banga abadde Jinja. What happened? He missed a bullet. I have seen here, and he was nearly killed.
Oh, but his colleagues are shooting. They are stoning the policemen. They are what? All of you are running our police mukono.
Hello? Yes.
All of you are running kuja kwa police mukono.
Kansindikireko Charles. Omwana baana babadde.
Kuja kwa police mundu.
Mundu.
Kale kampumule munange njiweyo.
iwe wawa ate kati ndi mu library
Oli mu office?
kubanga ndi nayo library wentudde wali G4G network wentudde njomala ngende mu bbaala
Erira.
Ndirira.
Bbaala ki owewaana tolina byonywa. Tolina byonywa bbaala ki.
Ngenda kunywa kawayini
Tolina amagezi aganywa.
ngenda kunywa
Tolina
wayini
amagezi
munnange
aganywa mwenge.
Nasani Charles wansuza lumu hoteli lituddeyo ddi gwe Charles soko owulire va mu ejo
Hoteli ki?
yakuddeyo mu hoteli eri kwebaka
Hoteli ki?
otwasuula naawe obadde ki
Uwa. Ewange.
otwasuula tomanyiiwo
ate kati naleese ekipya kyo ojja kujjayo ko mu January awo tojja kuvaayo Rubavu omazzi kwennyini Rubavu
wabbiyeyo ki ate kati wabbiyewa
ate nziba wano mu Uganda waliwo ekyokumba
eno Uganda nga zaabu nno
Uganda tewali
njagala kulabawo
Uganda tewali kyebagamba kale tumale break turesuminge sawa
aleso
Hello, Joshua. Nyoko. Why do you call now?
Moses, I think you're sharing your screen. I don't know if you intended to.
Yeah.
Everybody see your screen. I don't know if you intended to.
Yeah, I see
Yeah,
your screen.
because it is a problem.
You want me to stop it or you want to stop it? You sure?
You stop it because we're
Yeah, okay. Okay, good.
it's okay now.
Yeah, I took it off. I thought maybe you clicked by mistake.
Right.
I think we can resume. I'm ready, whatever you guys.
Let me first check in again.
Hey, wait. Can
Hey,
I have a problem with my screen. Let me
which phone?
You know, in fact, I would like to share with you regarding the topic of today, something that happened here in Israel through the COVID-19. But let's see, let's wait for everybody to join us. Are you guys with us?
Yes, we are with you.
Oh, wonderful.
We are following.
Yeah. In fact, it's really like a little discussion on two levels. One, to share with you a little bit something, special groups that do something informal in the healthcare really came out here in Israel in the COVID-19. I think it's an excellent example. And then I would like to hear if there's something we can do about it, or do something in Uganda for academy cities that can help, or even anything that has to do with technology and healthcare. I would love to hear, and we can probably do a lot of things. But first, let me start with, you know, when the COVID-19 started, really the one that got affected the most were the elderly, the one that, you know, old or sick or have precondition that they couldn't take care of themselves. And what happened is they start realizing if they end up in the hospital, they usually don't get out of the hospital. That means it's like one-way street. They go, they never come back. It's like they don't really get the treatment they would like, or at least they believe. And then there is an Orthodox Jewish, a very religious party kind of, they develop like informal treatment to the elderly in their house, meaning they arrange a group of doctors, mostly volunteer, some will get paid, and the rest some donations. And those doctors will go from one house to another house. And if you need breathing instruments or whatever, medicines, they will bring the medicines to the patient to their home. It was so successful that there were more than 2,000 volunteers, people, and the rest more than, I think it's around 1,200 or something like that, breathing machines. It was amazing, amazing story here in Israel. So I think that sometimes, you know, the alternative medicines or alternative, it's just because the system don't handle it. The system don't have the ability. And the other way to get it is not always by paying bribe or whatever it is. Sometimes could be done as a society as a good things. And I think that was a really good example. I was very impressed, very much. You know, I also volunteered to some extent, and my kids as well. I really liked it. And those things, I don't think it's only in the healthcare. I think it's true for everything. There's another organization in Israel called friendships, okay? Those guys, you know, they started this kind of a WhatsApp group, and my two kids also volunteer there too. You know, if somebody gets stuck on the road and needs help, okay, you might get stuck there and, you know, until somebody come and take care of you. You give them a call, they immediately send somebody to help you out. Change the flat tire. If your car needs towing, they have some towing cars for free. Everything is for free, based on donation and based on just good citizenship. Amazing. There are those kind of things. I think the healthcare is one very important element, but society can do a lot of things to really help. Let's face it, the rich always will get a better healthcare just because he's rich. And the system not always can provide what everyone should have got, unfortunately, but we can close the gap, in my opinion, in informal ways on really activities outside of the box. I think those two examples I mentioned before, it's really by private people that started this one. I myself see myself doing stuff. That's why I established Academy City. I think health and education, in my opinion, are the most fundamental things that every human being needs. And they are the two things that close the gap in society, especially education. Health is really a big topic, but education give a chance. Education give a chance. And now with the internet, thank God, you can be so remotely in a small village, doesn't matter where, as long as you have internet and a little computer, you can reach the whole world and you can close the gap big time. You know, that's why I bring those kids to come. I mean, I call them kids, they're not really Michael, Brenda, Daniel, to come and listen. Because, you know, they are all less than 20 years old. They are so brilliant. And honestly, I have seen, Charles know me, I taught in the best school. I studied in the best school in the world. And if I want to close gaps in society, there is nothing better than education. Then healthcare, in my opinion, a country being measured, and I think that's a point not only in Israel and Uganda, and many countries fail. It's our responsibility as a society to take care of people that have established the country, usually the older one. Who is really suffering the most from the healthcare? Let's face it. It's the old one that don't have the medications they need, usually, okay? Especially in the Western countries, becomes to be a big thing. And we as the younger ones should really take care of the elderly. It's even in the Bible. That's what we're supposed to do. That's my approach, okay? That's my take. I think, in fact, I would love to hear from you guys. What do you think could be done? And I will, if I can, okay, to do something that has to do with technology. I'm expert in education, technology, finance, economics, you name it. To do something that can help in Uganda in the topic of healthcare. So if there is any ideas or something, Charles, I would love to hear that too. If you have David, Daniel, everybody, but under anyone, go ahead. I would love to hear, and let's open the discussion. You guys talk about it.
Yeah, I'll wait for Batanda to make a comment first, then I bring in mine.
Okay. Yes, Amos.
Yes, I'm listening.
All right. You know, my network is the poorest among all of us.
Which one?
He's the poorest amongst all of us in terms of network.
Batanda?
I get off the video. Are you getting me?
He's poor.
Who is the poorest?
Batanda is the poorest amongst us.
Well, let's assume it's correct. But listen, you have two pictures. I see a picture and you at the same time.
Okay. Am I being heard?
Now we don't see you.
We are hearing you, but we don't see you.
We are twins. You know, we are twins here.
We still don't see you.
No, I've removed the videos that I can improve the quality.
Okay, go ahead.
Okay, now health.
Remove your video. You said you removed it. Now you have put it back.
As our professor has been, most of the current countries are.
I suggest you take the video off. Then we hear you better.
Okay. So
Yeah.
I was saying, health is a very, very big challenge. And one of the ways I feel we can improve our health sector, because there are very infrastructure from the human resource. As a person, basing on what we have right now, with the current infrastructure, with the current human resources, we need to do what I've normally told the persons who we chat with on matters to do with health: automation, biometrics, issues of attendance, issues of performance management, but in line with increment in salaries. That one, I believe, can go a long way in monitoring our staff, because right now you find that out of all our health centers we have, attendance is by manual. You just come, write your name, you're a nurse, you are a lab attendant, then in the middle of the day you run away. Yet patients are coming in, they need to be tested, they need to take blood samples for typhoid. So I think the first thing is attendance. And attendance, we need to go to use biometrics, using computer systems to improve on the performance of our health workers. But that one, as I insist, has to be matched with improved salaries and accommodation of these people. So for me, that's my take. For now, that's what I can say on improvement of our health system. There are many issues, but that's what I want to begin with.
Okay. Charles, you want to go?
I don't want to talk only about health services. If we are to improve the whole service delivery system in our country, we need to do automations. We need to do to ensure that data is synchronized. Because if you talk about health services and you are looking at how many people you are serving, you need to know the numbers. You need to know the numbers of expected patients in your hospitals. You need to know the numbers of the health workers you have, so that you compare and you know how many patients per, how many doctors per patient ratio. Then you need to know the number of health facilities. We are now in COVID, but tell me, how many people know the number of beds we have in the event that we break out? There is a heavy breakdown. How many beds do we have vis-a-vis the number of people? Because we need now to know how are we able to manage these people. And in the event that we are not able, do we have a system of following up those who are at home, who are doing home, like the Jewish community you talked about? Can we know the numbers and say, look, the hospitals are full, but we have people in their home. How many health staff are we able to have? How many facilities, like in terms of ambulances, do we have? How many ventilators do we have? Which can be delivered to the people who are home? You get me? Hello?
Yeah, we hear you. Go ahead, Charles.
Yeah. So this automation issue the data, we must collect the data properly in all sectors. If we are talking of education, for example, we know the number of children at home who are not in school because of COVID. But when we say we are going to buy radios for them to read, do we know how many homesteads we have? How many of these children are in each homestead? Do we need to buy a radio per homestead? Then we need to know if we are delivering materials for school homeschooling, how much material are we producing, and how many children are able to access internet at home, assuming we say we shall deliver like we are studying together now with you. How many children are able to access internet in their home? This issue should be cross-cutting in all sectors of service delivery, so that we are able to know how many people we are serving. Thank you.
Okay, I like that a lot. What do you think, David?
Okay, you had mentioned a number of issues, both Charles and Paul. I want to agree with them, but I've always had a challenge in understanding public facilities and public service. My challenge is, should things be free, all of them? Is there a free society where you enter and get things for free? Or to have a better service, even there should be a small contribution. I'm saying this because when I'm comparing education and health, a person comes from, and that's why many of our health centers are overwhelmed by a number of people, because everything is for free. So my question is, what is free? And
One
do
more
we
time,
continue?
David, what is it? So I didn't hear you. What is it?
What is free? I'm trying to bring my argument in this way. In Uganda, we have free health service on our health centers, and then private. But you find that many of our health centers 3, 4s, 2s, services are free. But I have a problem with this word free service. Is free service free? Is it achievable? Is it sustainable? A country like Uganda, can we sustain a free service? Or there should be a way we can bring a policy to say there's some little contribution, 1,000 shillings, cents of a dollar, so that people appreciate that there's nothing like free. I always have this problem in education where, because I'm comparing growing up, my father used to struggle as a peasant man to pay something for my education, to provide me books, to provide me pens. And he used to struggle to make sure I go to school. We're a big family. All of us, we went through that system. I'm comparing that and now, and I'm finding a problem. Where we have free, where did this thing come from? Where you come to a class and everybody is free. A parent can't buy a book, a parent can't buy a shoe, a parent can't buy a pen, and everything government must provide. So I'm trying to juxtapose these two systems, and I'm finding a problem. If we have to improve our health, should we fully go free service? Or there should be a small contribution so that parents are obliged. Parents now know we must work harder, because what is happening now, every parent has given up, let government, as if these children belong to government. I have a problem as an individual. It is a policy going around the world, maybe by IMF, maybe World Bank, I don't know. But the word free is causing all these problems of service delivery going down. You see, because I'm comparing free schools, primary in Uganda, I compare a school where parents are not contributing a single thing for their children's break. Even one, there's nothing. The kids go P1, go to school minus anything. You expect these kids to study properly? Do we have money in Uganda to sustain free service? These are questions that are bothering me. So my argument is, while we are discussing improvement of service, when do we have a line? When do we create a line to say, if you are going to a health center, come with 1,000 shillings, Uganda. Then it compels the parent or a caretaker to know this. I have to put something to get something, however little. But here you see someone moving, even buying a small book to write.
David, you said a strong statement, so I'm stopping you. Can you repeat it? I want those young guys to hear you again. It's such an important message. A very important message. What I'm saying. Say it again. And listen, Michael, Binder. And Daniel,
I'm
listen
saying,
to what he's saying. It's such a insightful. Listen to what he's saying. There's no such a thing as a free in the world, and you shouldn't count on it either.
I have a
Go ahead,
problem.
David. Say it again.
I have a problem as an individual because I've lived in two worlds. I've lived in a world growing up when my parents struggle to take me to school. When my parents contribute to get a Panadol or to get a drug from a clinic in my village. And I'm living in a world today where I'm seeing people assuming everything is for free. Government must give us free service. I get a problem. What is free? Where do we make a line? We all want good things. Are good things free? Where is the free lunch? So I have a problem. We are saying Uganda must have, the our system must be, but how do you sustain a country like Uganda, just 30 billion GDP dollars? How do we sustain free things from education to health to feeding people? How? I simply have a problem as an individual, and I'm asking you a question. Can we draw a line? Should there be a line to say a minimum contribution of a service must happen so that people don't throw their hands in the air and say government will take care, and then we turn around and blame government? What do you expect when you want a free thing? Is there a free lunch? Is there anything like free? This is disturbing me, and I need a debate.
Now, for me, I appreciate what David is saying, and this is where we go wrong somewhere. People think when they hear Israel, treatment is free.
Exactly.
They are told in America treatment, they forget that the American citizen is paying a tax.
Thank you. A big tax. I'm having a problem, doctor, because we have assumed.
David, I just want to make a point. I really like the word free. I came from Chicago University, and it's a very well-known sentence. It says there is no such a thing as a free lunch.
Nothing.
There is no such a thing. I mean, somebody has to make the lunch.
Sure.
Exactly.
There is no such a thing as free lunch. No, it has to come from somewhere. Somebody has to create it. I tell you more than that. If you get it for free, if somebody gives it to you for free, while you can get it yourself, it makes you a harm. It harms you by giving it to you for free because you become to be a bum. You become to be lazy. Okay?
This is where we go wrong.
Who should we give for free? Not really for free. It's somebody that really can't. God forbid, somebody paralyzed or has health care or whatever.
And Amos, you rightly said it. You want the young people to listen. I want those young people to know that they have lived on government fold, from immunization to education through UPE, USE, and the jobs that have been created in industries. Young people don't want to do them. They want to get a government job like David, like me, which jobs are not there. Uganda has only 400,000 civil servants compared to the 44 million. So somebody somewhere must pay this tax, which government will convert into the services that we give to do the road, to do the hospitals. So Ugandans must wake up and learn that we must contribute something to the services that we need. It is not about free and free, no.
It's
Because from there,
very much. Go ahead, Daniel. Go ahead.
I think the ordinary Ugandans like me and you appreciate that there's nothing free. But the government, as you call it, want to insist that there should be free things. For instance, because the levels of education have actually deteriorated because of the purported assumption that things are free. What this has led to is that you and me, we have to look for those schools, the private schools, which are damn expensive to have our children educated. So I wish the people at the top would listen. What David says is free is actually not free. You are paying indirectly. If you went to a hospital and there is no medicine, the beds are not there, then it's not free. If you slept on the floor, that's the price you're actually paying. So I'd agree with Doctor that there is no free lunch anywhere, except that you want to pretend that things are free. If you have not had the medication, how can you say now that that medication is free? For me, what that one has led to is to create another market, which is very expensive. We actually pay through the nose for the education of our children because there is almost no value, I'm sorry to use that term, in some of these schools. Because nobody is paying, then nobody is actually accounting. If you paid money there, I would bring the teacher to book. You'd go and demand, why didn't you teach? Why didn't you do this? But because you have not paid anything, even the moral authority for you to ask for accountability is not there as a parent. That is my small contribution to this debate. So the earlier government realizes that there is no free lunch, as they has called it, the better for us to move both health and education forward.
Conclusively on that one, again, you see, because it has bothered me for a long time. I'm in government, I'm serving government, but it disturbs me when I move around. For example, when I move around, I'm looking at a situation which will create a dependency population. A population that depends on service, free service. And this syndrome is causing us a problem. When you move around our villages, you'll find many men in the morning drinking because the kid goes to school, even if he's in a bare feet, that's the normal process. If my wife goes to the hospital and produces on the ground, that's fine, on the floor. So we need to come up with a line, a middle line, and say, when do we cut this line? What is the tipping point? There must be a tipping point. Otherwise, if you compare the population, all of us talking, the town clerks, we went through, our parents struggled. Whatever they did, these were bigger families than now, but they struggled for everybody to go to school by paying. Now you are seeing a population which is unrest, you know what I'm saying, which is now contributing to all this civil unrest we are having. They are less skilled because it's a free service. They get less skill, no skill at all. So they are wanting, they will expect everything for free. Therefore, they are lazy. Then it becomes a society that's going to be more destructive moving forward. Yes, it's a young society, yes, but with which skills? It's a younger society. What is it putting on the table? It's a young society. So look, all these things are scaring me. Why would we have a country like Uganda, a free service? Yes, I would understand their categories and their poor people, fine. But can someone contribute something? Can there be a contributory factor? Something. So that you go, okay. At least get, yeah.
Thank you. I would like to weigh in and give my contribution.
Please.
Yes, this aspect of free service is the one encouraging corruption, because even the public servants see it as not a contribution from the people, but rather something that comes from the government and has no true honor and whatever. Therefore, it is easy to misuse. I wanted Doctor to help us with the concept of in the US there was this thing called affordable health care. What is this package, and how can this concept be adopted in countries like ours? Affordable health care, which means there's still a contribution, but it must be affordable to the local population through their contribution. And also there's this concept which was in Uganda talked about, but it has gone silent, about public health insurance. What does it entail? What does it entail for the local people? What contribution is there in a public health insurance? Maybe if these concepts are greatly expounded and understood, probably they'll be able to solve this problem of really this call in quotes the free service, because otherwise there's no free service. People are paying for it. There's no medicine. The medicine is not enough in the hospitals. People have to go and pay in the clinics and what have you. And this indirectly has also affected even the consumption of the services. People now go directly to the health to the clinics and drug shops, and even their health is not being managed properly because those are not times professionals and what have you. So the cost indirectly is real high. So there is need to be real change in terms of bringing something which is affordable and can encourage the consumption of the services. Thank you.
I have a contribution.
Go ahead.
Now, for me, what I'm looking at is, these are colleagues. We are town clerks in the country here. What are we doing to influence policy? What are we doing? The national government is there. We are here in the decentralized environment. We need to act forward by influencing policy. Like you said, doctor, there is nothing for free everywhere. In fact, countries where people are paying for these social services, they do better educationally, in terms of health and all this. So we must embrace the element of paying for these services. But then it comes back to us. What have we done to influence policy?
We don't have
We need to point up a strategy. How we are going to influence policy. Yes, so I want to throw it back to us. What are we doing? We are talking about health insurance. How are we encouraging our government to put health insurance in place?
I was about to ask what he was doing in the break, but anyway.
You can see I've changed. So we need to work harder and influence policy. Chasanko here could become a member of parliament, and you are able to influence policy.
Ambrose,
Yes.
I would like to take your question. Unusual, Michael, Brenda, and Daniel, you are young kids. You are the next generation of Uganda. I'm going to take Ambrose's questions to you. What you guys going to do? Don't be afraid. You can say whatever comes to your mind. You know, the truth of the matter, you see all those guys, including me,
Yes.
20, 30 years from now, we'll be on a wheelchair. Am I right, Ambrose?
You are right.
So what are you guys going to do? You are the one that comes to the solution. I will give the question to Aaron. Half of the country is younger than you. What you guys going to do is going to be an example to all the rest of the other half of the country. And in addition, you're going to take care of us, because who's going to take care of us?
That's true.
So what do you think, Brenda? Go ahead, I want to hear Brenda. Say whatever to your mind, doesn't matter, it doesn't have to be right. I'm 50% of the time I'm wrong. So what? So go ahead.
So I think the point of automation is really key because of like we need to really, as they said, there's nothing for free, because with free things, there's no service delivery, because most countries that
But where's Brenda? We can't see Brenda. No, almost. I will need to see Brenda. Almost all of us on video. We need to see Brenda.
I introduced Brenda last time.
She's there.
I introduced Brenda last time.
But the face, the video.
Ah.
Her video is on.
Yeah.
Everybody's pictures is on.
But you will leave.
Go ahead. I want to hear you. Go ahead.
As I was saying, most developed countries, I know taxes have helped them because they pay. And I think that thing has to come out here, because that tax payment is really something that I think we should look at. It's because of most guys there is a way they deflate from paying the taxes, and then there is not enough money for that service delivery. And in most cases, I know Uganda as a developing country, as an economy that is still developing and struggling, we tend, we go and borrow because the taxes here are not being paid, and I think because of the low technology that is around the low technology that is in Uganda. So I think first of all we should look at automation where we know that everyone is paying taxes, even if it's at a small extent, small money. But I know if we look at that point where everyone can pay taxes, and then that goes again to the government officials where if people are paying, they should really account for the money that is being what, like the taxes they're getting. People can, the government officials should count, let me say from the corruption bit, they should also look at that, because if people pay the taxes, then the foreign money that is being gotten from outside, and again it's being corrupted on, you find that service delivery is a bit hard. Because I also have a friend of mine, like in government hospitals, her mom was sick, but in actually there is nothing that is free. Like we went to, it was actually at Uganda, China here. Her mom was sick, but she ended up paying some money. So I don't know, and yet that is it's a bit of a like the China Uganda Friendship Hospital. So I think.
Thank you, Brenda. Michael.
Well,
Charles have said something very important.
Yes.
About information.
True.
How important is the information? Because without the information, you can do nothing. Okay?
Yes, that's true. Actually,
if you want to talk, what do you think we can help, or what you as the young generation can do? And maybe later on we can discuss with Charles or with everybody, how can you, the young generation, can help? Maybe as a volunteer, I don't know, some way that you guys, the young generation, I think it's very important to get you involved.
Actually,
something that could be useful. Charles think that, and I agree with you, honestly, that you can't start anything without information. Garbage in, garbage out. If you don't have a very good system of information, you are useless in decision making. Okay, rule number one in decision making, get the fact right. Okay, and you got to have a good information system. But Brenda is talking about automation. I agree with her. Information and automation of processing or collecting, distribution, and accessing that information, okay, and making sure it's correct information.
You know, Amos.
Yeah.
One thing we must acknowledge is that we are still a young nation.
Say again?
We are still a young nation
It's
as
true.
Uganda.
Yeah.
We need to, it is like Ambrose was saying, how do we influence policy? We may not be able as town clerks to deeply influence policy, but we can come up with a document to guide. I will give you an example. There are things we underlook when they cause commotion and confusion in our places, but when the solution would have been sorted out. I will give you an example of one, land registration. There is a problem with land registration because there is no data. So you find a lot of land owned by different people. No, you can't know who actually owns it because of the different land ownership reforms. And what is it affecting? It brings conflict. Most of the 90% of the work the town clerk is doing is to solve a conflict. But the town clerk should have been in position to click on the button and say, this is my town. Who owns what in this town? So that you know immediately, this plot number 9 to 20 belongs to Amos. 1 to 7 belongs to Batanda. 10, but of course this is hidden because of other factors. People don't want to declare their assets. People don't want to be known. But even then, even if they are hiding it, it should be registered. Because ultimately, this is affecting land financing. Because investment is based on banking, and banking is hinged on land ownership. So if we don't have a proper land policy, proper land registration, proper land ownership, we cannot do investment in the country. Therefore, you cannot have taxes which will help people get the so-called free services they want. So the data we are talking about, which the young lady there is referring to, is across the board. We need to know everything, because when you go to Israel and you use your card to pay, everybody will know this is Amos from Netanya. He paid from here. But tell me what if in Uganda my colleagues can tell me. If you walk to Mbale with your ATM and withdraw money or you paid with a Visa, who will know that this is Batanda, his residence is in Pomode in Jinja, but he's working in Mbale? Impossible. Because we have scattered information on everything. I know it will take us some time to reach that level, but we need to start. Thank you. I'm done. I've made my contribution.
Your microphone is muted.
No.
Yeah, I'm saying in Uganda, you don't have a land registration automatic.
We have. We are automating it now.
Yeah. The government is automating it?
The government is automating it now.
My question is why the government has to do it? I'll be honest. Why it's not a private company?
No, because the Registration of Titles Act gives the mandate to government to register titles.
No, the approval could be by the government, I agree. But the processing and the whole management, administration.
That is trying to avoid fraud because already we have conflicts on ownership. So the only person who can confirm ownership is government.
No, I agree. The confirmation of the ownership, it has to be through the government. But the processing of the registration, putting it on the internet, let's say I take all Uganda, I put the whole things on the internet, okay? You click, you scroll in, you zoom in, you get to a specific land, you click, you see the land, who is the owner. It doesn't have to be processed by the government. That's a whole, using the information from the government, but somebody a private company will do it 10 times faster and cheaper and better than the government can do it as a brand, I have said, to automate that process. That doesn't have to be done by the government.
Maybe
you know, the process of confirmation, who is the owner, it's like, you know, whoever is doing it, it's like the judge, kind of. He has to really explore. It's not a simple process. There's a lot of politics. You have to make sure that goes out. It's a very big process. That I agree. That has to be part of the government. But the automation and accessing the information, you know, processing that the information is correct, putting it on the system.
Now, almost legally, the Registration of Titles Act still gives the mandate unless we are.
You are very soft, Charles. I barely can hear you.
What I'm saying, that the legal regime in Uganda, for now, provides that government will do this. And now they have formed the zonal offices, zonal land offices, which are doing this registration and automation of registration. So it is in the mandate of government, legally.
I see.
Yeah. Unless there is an amendment of the act.
You know, if I go bigger picture, how can we, let's say, look at those young kids. I mean, I again call them kids, okay? They are younger than my children even. How do we utilize them? They are brilliant. We have gold in our hand and we don't know how to use it.
I think this one we shall have to engage each other when we form the club, and then we see how we can put to use the young team that we have formed to see how further we can move with them. Of course, there is a lot of demand for IT in the different local governments. There are many areas where we had ignored over time on how to capture data and how to move and process the data and use it for our own good. I will give you an example. All those town clerks on board know that every year the National Planning Authority and the Minister of Finance has been changing the process of planning. Every year they ask for this, ask for information on teachers, ask for information on children, ask for information on parents. Now they want you to integrate that information in all sectors across the board. So if we have such younger people, we can easily utilize them to do this because our planning units are squeezed. They are small with limited staff. they may not be in position to do all this very fast. But we can find a way. My colleagues can discuss this further, and then we'll find a solution.
Beautiful. I think this is a good way to conclude. And honestly, I would say it's solving two problems. It's one is solving the issue of having the right information for decision making, and we're also solving the unemployment issues that popping up in the country because we're utilizing a wonderful resource and turning them to useful people instead of just being unemployed. It's really two problems that we're solving together, I think. I think that's beautiful. Anybody wants to conclude or say something? Go ahead, guys. Thankful. Thank you, guys.
Yes,
Go ahead.
Thomas.
Atanda, go ahead.
Yeah, first of all, this was also another beautiful interaction, very practical. But normally you encourage us to show our videos, isn't it, Amos? So I was requesting Amos, I want to know Brenda. I've not seen Brenda, Amos. And I'm suspicious.
Brenda
I don't know that Brenda is there.
Batanda.
Anyaka.
Batanda. She's called Apio.
Yes, yes.
She's called
Apio. What is that?
Asio, not Apio.
Yeah, Asio is the name from Teso.
No, Amos, just don't waste your time with Batanda. Batanda should not waste your time. We had a very fantastic training, and I want to thank you. This engagement was very good.
Yes.
I just want to urge members to come early next time. Let's meet at 4:30, 4:45, so that we can start the debate quite early. Sometimes come on late.
Okay.
Great. Thank you, guys. I really enjoyed it. And I think what Charles has said in the end, I think it's a good way to conclude the session. Thank you. And see you on
Martin should attend.
Thank you very much, guys. Have a good one.
But I don't.
No, you should give a vote of thanks.
I didn't show tomorrow.
You should give a vote of thanks, eh?
Next time.
Who?
Start drinking.
Have a good one, Moses. Good
Okay, bye-bye. Bye.
Bye, everyone.
Bye.
Thank you.
Take care. Thank you, guys.
Okay, bye, Amos.
Thank you.
Atanda.
Hey.
You can inbox Brenda.
Oh, Jai.
Yeah.